For this panel, let me welcome our distinguished speakers to the stage. A huge round of applause for Captain Bobby Ramesh, Group Director, Nursing Excellence, Avodhya Healthcare; Dr. Yasmin Sayed, Chief Medical Officer, IIT Delhi; Colonel Binu Sharma, Senior Director, Nursing, Max Healthcare; Dr. Sutapa B. Neogi, Director, IIHMR Delhi. And this session will be moderated by Dr. Sunil Khetrapal, Director, AHPI, Association of Healthcare Provider India. A huge round of applause for the speakers and the wonderful panel you're going to have.
I don't get any response. Good afternoon. I know it's a post-lunch session, so you are in that mode of having a nap, but don't worry, I'll keep you awake. I have, all the panelists are females. Nari Shakti, woman, Nari Shakti, the most power-packed session of the day. So let me introduce the panelist. We have one more panelist, Captain Bobby Ramesh. Yeah. We have, on my left, we have Dr. Yasmin Sayed. She is the Chief Medical Officer, IIT. Extreme left, Captain Bobby Ramesh, Group Director, Nursing, Sarvodha Healthcare. Then we have Dr. Sutapa Neogi. She is the Director, IHMR Delhi.
Sorry, JP.
And then, of course, Colonel Binu Sharma to the left, and Senior Director, Nursing, Max Healthcare. It's a privilege to moderate this esteemed panel on the subject that is redefining how we deliver care, clinical informatics. So clinical informatics is all about using data and digital tools to help doctors, nurses, and other care providers to deliver safe, efficient care. Now, most importantly, they are, the important elements, the important components of the clinical informatics. We all know they are all CIOs. Most of the delegates, people sitting here are the CIOs. So we all know the clinical informatic components: EHR, clinical decision support, data analytics, interoperability, workflow operations, patient engagement, very important. Now, as healthcare is evolving into the digital age, we are moving well beyond electronic health records. We started digitalization of healthcare with electronic health records. Now we have to think beyond. We are moving beyond electronic health records and routine data entry. So today, clinical informatics is about enhancing the intelligent, real-time, and clinical-friendly decisions that actively support the care teams. Now, in the Indian context, where there is a rapid technological advancement, this evolution is particularly significant and relevant. So clinical informatics must do more than digitize data. It must enhance clinical judgment, streamline nursing workflows, clinical workflows, personalize patient interactions, and strengthen institutional capacity. I think now I'll join my panelists there and start with a discussion. My first question is to Dr. Sutapa B. Neogi. The tech teams, they build the solutions, but what clinicians truly require or truly demand or they desire, there is always a gap. So how can institutions like IHMR bridge this gap through the interprofessional training or collaborative curriculum design?
So thank you very much for this very important question. And there is no doubt today that digital literacy has become an integral part of every department and every domain that we see. And whenever we talk of technology, we are reminded of few terminologies like AI or ML or robotics or telemedicine and things like that. Somebody said in the morning that there should be solution first and technology next. And I too agree with this and say that problem identification and solution first and technology next. And that is where we need to bridge the gap between doctors and technologists. And that is where the role of institutions like IHMR comes in. So we play a very crucial role as far as different activities are concerned. Firstly, skilling people. So when we skill people, we obviously are involved in long-term and short-term programs, and for which we are the ones which can bring both the sectors together. We also play a very crucial role in research as far as piloting of some of the innovations and technological solutions are concerned, and also their validation. So I think institutions or academic bodies like IHMR play a very crucial role in bridging this kind of a gap which is existing in the industry. That's all.
All right. Next question is to Dr. Yasmin Sayed. You are with the IIT Delhi as the Chief Medical Officer.
Yes, sir.
So, as a medical leader in an engineering institution, how do you bridge the gap between the clinical needs and tech development? I know you just told me that you have a hospital, 10-bedded hospital.
Yes, sir. Thank you, sir, for the question. And good evening, everyone. Ours is a very excellent primary healthcare center. And I must tell you that since late 90s, from early 2000, we have been using electronic health records for our patient. And in this journey, slowly, we have incorporated the clinical investigation, our pharmacy, everything is online. When we see the patient, we record the prescription digitally, and the investigation which we want the patient to undergo, that is also recorded digitally. And we have an outsourced lab in our hospital, so the patient has a cashless facility to do the investigation, and the bills are also raised online. And our pharmacy is completely online, so whatever stock of medicines is coming, we are keeping a digital record, and whatever patient's medicines are given to the patient, that is also digitally subtracted from those stock. So it is a very transparent system, and we have a facility in which we can just enter the unique ID of the patient, and we can see the past history, the drug allergy, whatever treatment the patient has undergone. And it is very useful in emergency. We are very equipped, we can act fast, and we can give the best care to the patient. Thank you, sir.
Thank you. Wonderful. With a small setup, it's a primary healthcare setup, but how the digitalization has happened in your institute, being in
Yes, sir.
IIT Institute, and
Yes.
your setup, I think it is commendable. Now, my next question is to Colonel Binu Sharma. Colonel Binu Sharma and we joined Max Healthcare together on the same day, that was on 6th November 2001. And we saw Max Healthcare, when in the day one, we were using EMR in Max Healthcare. That was in 2001. And how it has evolved today, say almost 25 years from now. So, Colonel Binu, my question to you is, you are the great nursing leader, and nurses, they are the backbone of the healthcare delivery. Yet, digital tools, they often overlook their needs. What are the requirements of the nurses? Normally they are being overlooked. And in your experience, what should be the next gen clinical informatics product which should prioritize to better support nursing workflows and decision making?
Okay, thank you.
Efficiency.
Thank you, Dr. Sunil Khetarpal. And thank you, DHN, for having nurses and doctors on the panel, because they are the ultimate users of the digital solutions which are created by the industry, IT industry. Why do we need digital solutions? It must improve efficiency, accuracy, documentation, patient safety, and clinical workflows. If we do a study across hospitals where we have solutions, do we all have a data? How much have we improved in efficiency or in accuracy or in data analytics or dashboards? If we do a survey across nurses and doctors, do they feel hassled by the digitalization? Do they feel supported? I am all in for digital solutions, because that is the way to move forward in healthcare. And in India, we have humongous volume of patients. You have no choice but to move to digital platform. There are enough digital platforms and solutions. You have one solution for EHR, another one for material management system, third one to manage diagnostics, fourth one to manage patient feedback, fifth one for incident reports, and each hospital must be having 20, 30, 50 different platforms. Nurses and doctors find it extremely difficult to navigate between different platforms. They have no time, patient volumes are high, doctor-patient ratios, nurse-patient ratios are always questioned because we always fall short of clinical teams in the hospital, definitely nurses. There is high attrition in the clinical teams and more so in the nursing. So I think what we are looking at in the next decade are solutions which are simplified to help nurses and doctors, and I'm talking about nurses, help nurses to have easy solutions, user-friendly, there is no wasting of time, easy to adopt. And when the solutions are getting done, it should not be imposed on the clinical teams. It should be made for them, with them. Buy-in, adoption, simplicity, efficiency, all is going to improve. And above all, the patient safety is a question mark. AI and digital platforms should help us improve patient safety. That's my take on this, Dr. Sunil.
Wonderful insight. I think all the CIOs must make a note of what Colonel Binu Sharma has just mentioned, that nurses are also to be given equal importance in this whole ecosystem of technology. Now, my next question is to Captain Bobby. Bobby, from a nurse leader's perspective, what are the challenges do they face, the nurses face, when adopting to digital platforms? Because it's always a challenge. It is a challenge with everybody, all the stakeholders. But what are the challenges faced by the nurses, and how can we make informatics more friendly for nurses?
Thank you, Dr. Ketapal, for that question. Good evening, everyone. And I'd like to take this opportunity to thank Mr. Vishnu Saxena and the entire organizing team of DHN for this wonderful opportunity. So thoughtful of you all to have two nurse leaders in the same panel, which otherwise normally doesn't happen. And one of the major challenge, as already Colonel Binu has mentioned, and not involving the end user while selecting the software itself. So nurses are the main users, being with the patient 24/7. Their inputs are not taken into account, nor they are involved in the decision making while selecting the software itself or the EMR. That is one of the major challenges which hospitals in India face. Now, coming to once it is implemented, the common challenges which we face as nurse leaders is that I'd like to use the acronym TEX. The first is your usage, technology usage, the generation gap between the older generation and the younger generation. There's a big gap. Now, because of the gap, the seniors may be finding it difficult to adopt because of lack of training, and the tech-savvy, the younger generation, they may be finding it easier to adapt. So training and education play a very important role in overcoming this challenge. Then ease to use and user interface. Many times, many of the hospitals have different interface, different softwares. So people, they keep moving from one hospital to another, and there is no uniformity in the software which they are using. So that leads to a lot of confusion and difficulty in adapting to that. Communication and collaboration barriers. Again, interoperability issues. There is no collaboration between different teams which are working, and there's no much of support also from various teams. And here too, all these issues lead to communication issues and collaboration issues. There is not seamless integration between various departments, which leads to a lot of difficulties when the nurses operate those systems. Then health data security issues. Many times we find nurses logging in and not logging out, because of which there is a data breach, confidentiality and security issues, and lots of training needs to be given that if somebody is logging in, they have to log out after they use their system, and they should not be sharing their password with the other nurses. So continuous training is very much required.
lack of technical support from their own nurse mentors is one of the major challenge. To overcome this, you need to have preceptorship program, you need to have adequate handholding by the nurse leaders who are tech savvy, you need to have more nurse informatics officer in the hospitals, which is not the case. You have very few in some of the corporate hospitals, you have very few medical informatics and nurse informatics officer. You need to have more nurse informatics officer to handle the juniors, and also technical support and live desks should be available so that the nurses can use it freely and easily.
Thank you. So the hospital needs to create a post of CNIO, Chief Nursing Information Officer. So that's the message which she wants to give. And of course, we have paucity of time, and hardly there is 5 minutes left for us. So I'll quickly ask another question to each one of you to answer in 1 minute. My next question is to Dr. Sutapa Niyogi. Given your academic and public health background, how can the clinical informatics be aligned with the population health and preventive care models in India, including the epidemiology part?
Okay. So whenever we talk of any informatics, be it clinical or public health, there are three basic elements which come to our minds. First is use of data, which is actually a rarity. Use of data for understanding the risks and the prognosis and the diagnostic. Although we all bank on data, but use of data which gets generated through this platform is never analyzed. Second is a technology bit. Although we have examples like pedometer, smartwatch, etc. as successful innovations, there is also a successful model which is in the public health sector, which is eSanjeevani. It is the largest telemedicine catering to the primary healthcare, which we all are proud of. The third part is information system, which again takes care of two basic requirements of any healthcare system, which is reporting and decision support system. And there lies a challenge. There are four typical challenges that we always confront. First, as Binu said, multiple platforms, multiple portals, the same information of the same patient gets uploaded in multiple places, yet all the analyses are different. So this is where we need to chip in. There is a requirement of integration which the government of India is actually working on. The second part is about the collaboration, which you mentioned. Collaboration means involving all the stakeholders in any health setup for any decision making. Third, I think most important part is the lack of involvement of the private sector in such initiatives. We need to analyze the data of at least one hospital to get a very clear and a holistic view of what is happening. So I would say that these are the four major areas which needs to be addressed whenever we want to advance clinical informatics as a...
Thank you. Thank you for your insight. My next question now is to Dr. Yasmin.
Yes.
Now, how do you see clinician technologist partnership, in evolving this, to ensure the responsible, scalable, and ethical implementation of AI and informatic tools?
Sir, actually, I feel that we should create a unique health ID as we have a Aadhaar ID, and all our information should not be used to the digital partner or the hospital or the stakeholder who has bought that information technology or who is using that software. Instead, it should be linked to the patient. And as soon as you use that ID, you should be able to look into the history of the patient, the treatment of the patient, and all data should be available at one go. That can make the ease of the using the technology. It will be more be accepted by the doctors as well as the patients. It can be cost saving also because there will be no duplication of the same thing happening again and again. So, and there are challenges in our country. We have to have 5G kind of network. We have to have more and more training of the doctors so that they adopt the technologies. We may have technology in place, but we may not have the training also. So we have to bridge that barrier. If there's one thing, usefulness, and there's another thing, usability. So we have to make it more usable, and we should try to make it such that it is beneficial not only to the patient, to the clinician, as well as the whole community also, and the country also. Thank you, sir.
Thank you. Bilu, I have one question for you, which I've got two parts. First part is, how do you see technology improving the nurse-patient engagement, number one. Second part of this question is, balancing technology with empathy, balancing automation with empathy. So, human touch is something we always talk about. The technology, cannot overrule this human touch, which is actually empathy, and which is what the patient expects. But how do you balance technology with automation?
Okay. Actually, these are two parts of same question. Empathy, compassion, and technology, does it fall into one bucket? And how can nurse-patient engagement improve or clinical equity? I would say if right digital solutions are implemented in the hospital, nurses are going to save time, and this time saved is going to be spent at the patient's bedside, communicating with patient, reassuring patient, giving more comfort, more compassion, and spending more time with the patient and educating the patient about the disease management. That is part one. Secondly, with right solutions, nurse-patient ratios can be optimized. With digital solutions, the nursing roster, which is a humongous task for the nursing in charge, supervisors, etc., there are excellent solutions for rostering, dynamically changing solutions that should be implemented. And the last part I would mention here is on material management system. All who work in the hospital will know nurses spend at least 15% of their working time in managing materials inventory of various items, and that time should be saved by digital solutions, barcode scanning, other solutions available in many countries, so that nurses definitely with digital intervention will have more time at their hands to spend with the patient, and educating and managing patients will improve compassion and the nurse-patient engagement. Yeah.
Good. Thank you. Last question to Bobby. What is the one thing that is missing there's some urgent feature which you think that most important and an urgent feature which is missing for the nursing IT?
Which is missing in the EMR
Nursing
for nurses.
teams, yeah, which is required in hospital IT system, which is missing.
Thank you so much.
As not meeting the nurses' requirement.
Thank you so much, Dr. Ketapal. There are many, but the priority, the most important one, which I feel is that integration of early warning signs with AI and predictive analysis. Even now, those hospitals having EMR also, nurses are doing it manually. Because of doing it manually, the scoring doesn't match with the patient's condition. Timely deterioration cannot be captured. If it is integrated with AI and predictive analytics, the patient can be saved on time, the deterioration can be captured on time. It not only saves the life of patient, but also it improves the efficiency and accuracy also. This is one of the most important. But I wanted to add one more important thing, which is a pain in the neck for all the hospitals, is that for NABH also, it is mandated to have a nursing care plan based on the patient's condition and the patient's diagnosis. If the software, with the help of AI, can, have an automated plan of care for nurses, from that they can choose, then it becomes easy for the nurses. Thank you so much.
So I think I'll just wind up because time is already up when we have been allotted 20 minutes instead of 30 minutes because we were already running late. So in the end, I will just sum up that the clinical informatics is not just about digitizing care. It is about transforming care delivery, making it more patient-centric, data-driven, and outcome-based. Thank you. Thank you all the panelists, and thank you all the audience for being a lovely audience and not dozing off. Thank you so much.